Country heads towards its COVID-19 peak. Special precautions are being taken to protect the most vulnerable. The elderly are at a much greater risk for severe disease and death. So how are they then being protected, both physically and psychologically? Now, eNCA's Barry Bateman takes a closer look.
When the global COVID-19 pandemic took hold earlier this year, it quickly became apparent that the elderly were among the most vulnerable. As you get older, your risk for severe illness from the disease increases. In South Africa, more than half of the recorded deaths were people over the age of 60. So special precautions are needed at homes which care for the aged. In March, the Jaffa Old Age Home implemented strict access and hygiene controls. Despite all their efforts, a month ago they had an outbreak. 40 residents and staff members tested positive, with 6 of the elderly sadly passing away. But they say they've managed to regain control.
As of today, we are now considered disease-free in the home. There are no more symptoms in the home, and we haven't had any new cases. It is scary. It is scary. We buttoned down, locked our residents in their rooms. We put them onto room service. My kitchen go out 3 times a day with meals in takeaway containers. They go twice a day with tea and coffee.
Protecting residents from exposure to the disease is paramount, and it's changed the way staff interact with them.
All staff going up onto the floors wear PPE, full PPE, starting from shoe covers, covers up their shins. They've got jackets, we've got bags. We use as many protections, as many layers of protection as we can.
While being confined to small rooms may protect the elderly from exposure, this presents another challenge: loneliness. But it can be addressed.
Putting like these screens up to say that you can visit someone, but then you need to be on the other side of the screen. There's also homes that now put up tents to say that there is 2 rooms in the tent, so we can make a plan around that. And there are some homes that could not afford any of those measures to be put in place. Still want to be cautious, and therefore telephone calls is now like in a scheduled thing on a daily basis.
Caring for the elderly requires extreme caution, and those entrusted with this duty are taking extraordinary measures. Barry Bateman, Pretoria.